Hello, this is Dr. Scott MacLean, and this is a YouTube presentation about the Zest locator attachment. Our case today is about a lady who had 4 implants placed with locator abutments. You can see the female abutments here. And what happened was that one anterior abutment, the lower right one, was not engaging when you placed the overdenture in her mouth. And so what would happen is when I placed it in, the abutment just wouldn't engage down. This is without any kind of functional forces, working, non-working, protrusive. This is just when you're placing it in. And this is different than if you're loading the overdenture and you have rotational forces. This is another reason why you may have to reline the denture if you're finding the rotational forces are knocking it out of the kind of attachment system. There are a few things you should check prior to assuming that you're going to have to change the denture cap housing, and these would be to make sure that there's not tartar in the area. You can see here I initially started with the blue caps and then switched it out for the red caps, and the lady had quite a bit of tartar. So we did clean this tartar up, and then she's back in with, again, a lot more tartar. So this is not the reason it's happening, but it's something we have to look at. Male plastic resilient caps can also wear over time, and this could be another reason why the overdenture is not engaging down on the female abutment. So these have to be checked prior to, and if they're a problem, then they need to be switched out. Prior to changing the housings in the denture, it's important to check the female abutments for any scratches or any kind of wear marks, because this could be the reason why it's not snapping down. Here you can see the nitrile surface is quite good, so we're okay. However, sometimes you'll see the metal actually wearing. You'll see the shiny part coming through as shown here. And this means you have to change the female abutment. Posterior bone loss can also be an issue with having long-term fit of any type of abutment, because if the denture is kind of flipping down the back, then this is going to be an issue for how they're going to fit in the front. So sometimes you have to do a reline of the denture to have these abutments fit properly. The locator system is actually a very low profile attachment, which is great because it gives us the ability to put these into areas that are quite tight. So one of the things we should look at is first is how the abutment itself is kind of structured. You can get these in different heights, and these can be screwed down on top of the implant. One of the neat features is that there's a triangular area that allows us to put the driver in to screw these abutments down on the implant itself. One of the ways you can measure for the space is you actually take a Bowley gauge and measure from the intaglio surface to 90 degrees to the surface, and you can measure and see how much space you have there. But what we really need is about 7 millimeters of space, so 4 millimeters of resin over top and 3 over this, which gives 7. If you have a little bit less than this, you can still get away with that, but it's nice to have a little bit extra if possible. One of the neat features about this system is you can change the amount of pressure on the locator housings by changing the cap. So here we're using 4 red ones because over this would be overkill, because these actually stay in quite well. So prior to doing this, we're going to tighten down the female abutments on top of the implants to make sure that they're secure, because this would be one of the reasons why the housing or the attachment may be loose. So we just want to make sure that this is verified and checked before we continue on. I'm using the torque wrench with the mandrel in it to tighten these down to about 25 to 30 newtons, which is recommended by the manufacturer. One of my favorite tools with this system is the locator core tool, because this can do a number of different things. What you'll do is back it up about 3 screw turns, and you're able to kind of pull out the red cap, which will allow you to change them, and you can just spin it back down. You can see it will pop it off. So it's a very, very neat design. And this will allow you to change the retentive caps as the patient comes in, but also it'll allow us to put things back in this area too. So I'm not going to take out the other ones in this particular case, but if I was, I'd unscrew it about 3 turns and then put it in, and it will pop it out. We're going to use a straight handpiece to take out the denture cap now. These denture caps really can't be used twice, so you don't have to worry about damaging them, because they're going to have to use a new one when you put it together. So here's the new denture cap, and we're trying to get this old one out so that we'll have enough space for the new one to be placed in this particular location. Because we're going to place it in such a way that we're able to pick it up in a very precise spot. And this is one of the best ways to do this is intraoral, because sometimes there's some different things that happen when you try to pick it up and do it in a lab process. But this way you're going to be sure that you're going to pick it up, and it will be in a position that's going to be allowing the maximum type of retention for the locator cap. It's important to clean all the debris before you start to do your bonding procedure, and certainly microetching it is also a good idea. I like to create a little lingual relief area so that the resin will actually express out through this hole once you're placing it on, and this will allow for easy cleanup, and you can just polish this up after it's kind of finished the curing process. You'll just see a little nib of resin in that particular area. I like to check the retention of the other abutments at this point prior to kind of changing anything, because I can see that they're all engaging, and this is important because when I go to put things back in, I want to make sure that those are going to engage, and then I'm going to be picking up this particular abutment and the denture cap at the same time. So then I can just be sure that it's not pressing too much around that particular area. The VLC bonding agent from Triad is going to prepare the surface so that it will bond, and then we're going to be light curing this so that we actually get a real prepared surface for great bonding. You take the denture cap, which is part of the Male processing package. You'll order this from either Nobel Biocare or from Zest Anchors, and you're going to use this processing cap and put the black component in there. So the black is going to enable us to make sure that this is going to seat down really straight on top of the locator and not be pivoting around. So we'll take the white ring here, and this will stop resin from going down around the implant and the abutment. And we take the denture cap and have the black processing cap inside and snap it on. And it's very important now to check that this all fits in and still fits the same way that it did prior to having anything in there. So we can see that everything's still snapping down. Now I'll take the Triad DualLine resin and inject at least 2/3 full in the little socket that I've created for the locator, because a lot of this socket is going to be used up by the locator itself, by the housing and the denture cap. The excess Triad resin will express out the lingual shown here, and this will be cleaned up later on when I use a buffalo burr just to kind of take it, and then we go and polish it. And we'll also clean around the black processing cap you can see here. So this has held the locator in a very precise position during the bonding, because we don't want to use the red or some other color, because those actually have a bit of a pivoting action, and we don't want that to happen. I'll take again my favorite tool, the core tool, and pop out that black processing cap, and then I'm able to kind of push that off by tightening it back down. Now here's a real neat part. We can take apart the core tool, and inside is the part that's going to actually snap the red retentive cap back into the overdenture. So we take that and carry it to the mouth, and it just kind of sits on there and rests with just kind of friction, so you have to be a little careful. So you take that to the denture cap, and then you'll hear it kind of snap down inside. Once it snaps, it's then going to be in place, and then really that new housing is going to be in the position of where it's going to be kind of making it a very effective use, because when you have 4, sometimes it's difficult to pick them all up. So we have about 1 pound of retention now in that particular area, but we have 4 of these, which makes this denture very difficult to get out, which is a good thing because the patients usually love this. So we clean it back up and get any last bits of tartar off the denture, and make sure that the denture is going to fit in properly, and then the patient's all finished up. So it's been a quick and easy appointment for the patient. We're able to do this chair side in probably about 5 to 10 minutes. And the patient's able to leave. We're able to check their occlusion, making sure everything works properly. And once again, this is one of those easy things you can be doing yourself. So this is Dr. Scott MacLean, and this has been a YouTube presentation about the Zest locator anchor for overdenture attachments.